All right, hello. Welcome everyone to today's webinar. This is webinar number 7 in our Stay Connected weekly webinar series here at Aruba. They've gone by pretty quickly. We're used to doing a bi-weekly webinar series, but in light of the current situation, we thought it would be a good idea to go ahead and connect with you all and really kind of give you a flavor from different industries on how businesses are dealing with the current pandemic and the business situation, business climate. And so we thank you for joining us. This is part of the weekly webinar series here at Aruba. We're a Hewlett-Packard Enterprise company, and my name's Anthony. I manage the webinar program and appreciate you taking the time to join us for today's topic, healthcare, and specifically how healthcare IT can ensure delivery of expected services. We kicked things off 6 weeks ago with our how your network can deliver business continuity to you and your employees webinar, and over the last 5 weeks or so have talked about healthcare with today's presenter, Samuel Hill, and we talked about education K-12, virtual call centers, the retail industry, and how they're all adapting to meet these new challenges. We are joined today by Samuel Hill. He's the Senior Manager of Healthcare here at Aruba, and Samuel will give us some tips on how healthcare IT can keep delivering those expected services in today's business climate. But before we get started, and for those of you who are joining again and have joined past webinars, you know there's a little housekeeping that we like to do. First, want to let you know there's a box underneath the slide window, and that's to ask or submit questions. Please ask those questions throughout the webinar, and we're going to save them for the end. In the past, we've answered them during the webinar, but in this case, we're going to go through the content, and then I'll moderate the questions and present them to Samuel in the order in which they were received. In the event we aren't able to answer the question and we need to go to another team member, another colleague, or we just run out of time, I will follow up directly with you using the email address you registered with. So that's for questions. We also, for those of you who are new to the Bright Talk platform, present a feedback form right at the end or when you leave the webinar. It's a simple 1 through 5 star rating, and we have used that feedback along with an open comment box. We have used that feedback to change the way we do these webinars over the course of a couple of years. So the webinars were usually right up until 60 minutes, the full hour. We've cut that back a little bit to allow more time for questions. Sometimes we end a few minutes early, but that's one of the examples of how we modified based on your feedback. So one other item is you can ask questions all the way up into the Q&A and even during the Q&A, so we'll get to those questions as well. Do want to now introduce Samuel Hill. He's our Senior Manager of Healthcare here at Aruba, and welcome back, Samuel. It's all yours.
Hey, Anthony. It's really great to be back with this wonderful audience from Aruba here and all of those that have been attending this webinar series. We're grateful for your time and also grateful for all of the hard work that you've been doing in our communities to keep us safe, to prepare and to treat people as we make sure we navigate this pandemic together. And so I know for myself personally, I am highly grateful for all of the hard work done by most of those and many of you who are on this call that are working in healthcare. As Anthony mentioned, I lead healthcare marketing for Aruba. And a little bit about me, I came out of the healthcare industry. So I worked for 7 years as an emergency room technician at 2 different health systems on the west coast of the United States. And I've been with Aruba for almost 4 years, previously to in a sales role, covering a sales territory where I sold to some of the best healthcare organizations in the Pacific Northwest, which is where I live. I wanted to start our conversation today around a specific topic. We're going to be very, very focused on one type of deliverable for your healthcare IT environment. And so we're going to get very specific on a recommendation that I would make that everyone should take some action on and deploy in their networks to make sure that they're going to be able to deliver the expected services that are needed of them in this time. So as I mentioned, I worked in an emergency room for about 7 years. And I wanted to tell you guys a story that comes from the emergency room time. And I'm going to do my best. As you can imagine, those of you that work in healthcare and have, I hope professionally spent time in an emergency room, not personally. The difference being, as a professional, you go in there to work, to perform service, whether it's troubleshooting a network or visiting and interviewing staff, and not personally where you're actually there to receive care. I hope, I hope your time has been more professional than personal in the emergency department. One of the things that happens in ERs is a word called trauma. Trauma is where there's a specific and life-threatening emergency that happens where people come to the emergency room in the most critical and most dire state of need. One of my friends who is an emergency room physician, he describes it this way. He says, emergency room doctors are experts. They're specialists as well. And many people don't think that, but they're specialists. They're specialists. Their specialty and their expertise is the first 15 minutes of sustaining and saving life from a patient that presents to the emergency department with a life-critical injury. And so this is a story of just a situation like that. And to back up just a little bit, I worked at 2 health systems. The first system that I worked at was a trauma center. That means they had specialty and expertise in trauma, the right levels of trauma surgeons and specialists, whether they're the different specialties that go along with serving trauma. The second health system I worked at was not a trauma center. They would do their best. And so this is a story where the system that I worked at just did their best, where we had a patient that presented to our emergency room. She was pregnant. She was young, pregnant. She was in the midst of having really terrible seizures. And there was just this really awful history of drug abuse, substance issues, and just a very, very sad case to begin with. But she presented, I think, 8 or 9 months pregnant, laboring and seizing and basically dying. And this was probably the worst possible thing that could be happening. And again, this was not a trauma center, so there wasn't a dedicated team. So everybody was rallying to support and care for this patient and her unborn child, and to do their best to save the life. And you should have seen, I mean, we had people, we had like the department leaders and the nurse managers and everybody coming out of the woodworks, coming out of the office, going by that room, barking orders, everybody screaming and yelling and really trying to get everything done appropriately and figure out what needs to happen for this patient. The long story short, I'll focus it into this comment here without getting very graphic. But in trauma, it's actually very simple to work with trauma. Trauma is very much a algorithmic or logistical flow. You start with the airway. You start with making sure the patient has a patent or open and usable airway. They've got to be able to get oxygen into the system. And once you fix the airway issue, then you can go on to B. You've probably heard this in your CPR classes or anything else that you've done from first aid and CPR. Next step would be B for breathing. Once you fix that their airway is able to receive and exchange oxygen, now you actually need to go about the work of exchanging oxygen, getting air into their lungs. And then finally, after that, you worry about their circulation, which is getting the heart to pump blood. Hopefully, and most specifically, the need is to get the blood pumping to the brain to prevent any long-term damage. So trauma actually really, when a patient presents with trauma into the emergency room, those are the steps they take. The first thing you look at is their airway open. Check. Are they breathing? Check. Now with their circulation we'll work on that. And then everything else that you would do kind of flows from there. So this patient presented, and I don't think the outcome was good for her, but I do think they actually performed an emergency cesarean surgery in the emergency room and were able to deliver the baby. And I obviously don't know the follow-up to that, but the baby came out and I believe lived. I'm not sure about the mother. But again, trauma focuses your priorities. And for all of you that are listening to me talk and are now saying, why did I choose to spend time listening to Samuel tell ER stories? I'm out. That's disgusting. I understand. I get it. It's tough. However, the analogy is this. When it comes to a situation you've not seen before, an emergency, which I believe this coronavirus pandemic has presented an emergency to healthcare IT, our focus needs to get very simple. It needs to get very back to the basics of the most important things in IT. So that's what we're going to talk about. Stephen Covey says it this way. The main thing is to keep the main thing the main thing. And that makes very little sense, but then when you read it closely, you can start to understand. Well, what is the main thing in healthcare IT? The main thing. Now, that you might have a lot of different answers for it, but I would argue that the main thing in healthcare IT, especially in this situation, is we need to deliver a consistent experience at the edge of your network. And I'll define the edge of your network as the place where all of your users and devices and things, where all of that stuff in your healthcare network, the place where it connects, that is the edge of your network. What's the experience like of those connections? What type of connections do they get? Do they get wired only, wireless? Are they coming in through VPN? What is the service level that they should be expecting? In this emergency time frame, we're presented with the need to care for a network. We've got to get back to basics. We're not going to be making a lot of changes, a lot of unique adjustments. We're not getting fancy here. We're trying to make sure that we're delivering a consistent experience at the edge. So I'm going to start this, I'm going to put a poll up right now, and I'm going to start this voting. I'm going to ask you, what is the most common issue that prevents a good user experience at the edge? And I'm looking for some responses here. Take some time, go over to the poll that we just posted. As you look at the list there, what commonly prevents a good user experience? As we know today, the users are highly important. Their experience of the network and the performance of the network is usually what they call and write IT tickets about. And looking at some votes here, we're getting some people coming in, some votes here for applications, other people voting for devices or the network. Looking for some responses here. Feel free to go ahead and put your answer into the poll there.
Hey, Samuel, real quick.
Yes, sir.
I want to thank those who have already shot us a couple of questions about the attachments and links being for this upcoming Thursday's webinar around education. We apologize for that mix-up, and I have received word from our support team at Bright Talk that we will be able to add the correct attachments in the on-demand version. So in the event we get finished and another hour passes and this is posted on demand, you can come back and look at the correct attachments for this webinar around healthcare when those are available in the on-demand. But we apologize for that. I appreciate your understanding, and thanks a lot.
Yeah, thank you, Anthony. Looking at some good votes coming in here. Thank you for everyone that's responding to our poll. Right now, the leader in the clubhouse, if you will, is the most common issue that prevents a good user experience of network connectivity is the network itself, coming in at actually kind of an overwhelming majority here. So I'm going to leave the poll up, and we'll kind of check back in on it here as we continue our conversation today. Really curious to hear. Obviously, we have our view of what prevents good user experience, but we do want to hear what yours is. So if the main thing of this time, what we need to focus on is, just like we said earlier, we got to look at airway, breathing, and then circulation. The main thing is to make sure they have the ability to exchange air. So for us, we have to keep the main thing focused on the ability for users, devices, and things to connect with an optimal experience. So I want to introduce a very powerful tool to you. This is something that I think every healthcare IT shop should deploy in their network. And again, this doesn't matter. This device is not going to be specific to an Aruba network or a Cisco network or you name the configurations that you have. There's no limitations on where it can be deployed. But what this is the Aruba User Experience Insight Sensor. And what that means is we're deploying these all over different types of companies and customers to do a couple of different things. The primary focus of it is to give you as an IT shop a view of how a user is experiencing your network. So very simply what this does is it sits in your environment. It is a sensor, and it begins to broadcast and connect and run synthetic testing traffic against all of the key services, applications, locations, and destinations that you have on your network. And it begins to run that traffic and give you feedback reporting that says good, bad, needs improvement. And so you get to see in real time how a user is experiencing your network. Here are some ways that people use this. You all know that in healthcare, there's probably that one conference room which your CEO and executive leadership team uses to meet with the board of directors or other VIP people. And you probably know that they have, they usually will have some complaints or issues in making sure that room is up and running and performing at the optimal level. And we want to make sure that they're going to get the type of experience that the executives and leaders of your health system need. So putting a user experience insight sensor will be able to run traffic against all of the video services that you have, whether they're hosted on-prem or in the cloud. It'll be able to troubleshoot or give you reports on the wireless connectivity and how good the speed is and the connectivity, either whether it's a DNS response or some DHCP scoping. It'll run that against the wired network as well. And it'll be able to start testing all of the key critical components in that environment and give you a report in your email before you even show up for work that day, knowing that, hey, our CEO is going to be reporting to the board on the latest financial performance. And you'll have that report in your inbox that morning when you arrive to work, so you can make sure and ensure that performance is really good. Additionally, a lot of users, especially clinical care users, as they are roaming their care units or out on the floor, they're out there saying, hey, I was having bad connectivity. You know, and a lot of times, they actually don't report it. They're too busy. They're not going to sit and take the time, even as simple as you make an IT reporting system, they're not going to take the time to report bad connectivity or poor application performance or, you know, man, it took Epic, 35 seconds to load up when normally it only takes 10 seconds or whatever that report. They don't usually report that to IT. What the sensor is going to do is it's going to sit on the unit and it's going to run synthetic tests to, whatever those key applications are, whatever those core services that you need monitoring. And it's going to provide you back a user's view of that network. How are they experiencing the network? So that way you can go and troubleshoot when it gets to, hey, it's 50% degraded. It might still be returning traffic and performing, but it's not giving a user the full experience that you as an IT shop expect your network to do. I'm going to pause right here and take another look here at our poll. Looks like we have a pretty clear majority here. So with actually a great handful of you voting. Thank you for all the votes that have come in. This is a good number of votes. We have the network is the most common preventer of a good user experience. They come in at 66% of the vote. The network is the usual culprit for providing a good user experience. So yeah, thank you. Okay, a couple more votes trickling in. This is fantastic. Yeah, wonderful. Thank you. Continue to send your votes in. We want to hear from you. And it looks like there is a significant headache from a lot of you out there about how your network delivers a good user experience. And so again, this is a tool that we want to offer you to be able to provide more feedback and a better closed loop system to understand how your users are experiencing it. So again, this is going to be a little different than traditional network management or network, things like a SolarWinds or an Extra Hop or those that are actually looking at the network traffic. Those are typically looking at from the network's perspective of how are things traversing and performing on my network. This is looking at the network from a user's perspective, which is how are users receiving the applications and the services that the network is presenting. So the user experience insight sensor is not going to be returning you issues with routing protocols or issues with broadcast or anything else that would be in your network itself. It's going to look at it and say, hey, what was the round trip time to the main to get a DHCP address, or what was the DNS service like, or how long does it take for me to get to and from Epic, or what about my radiology system? What about the PACS systems, or any of those important elements? Maybe it's your Citrix farm for VDI, or maybe it's, you name it. You can start picking out those applications. Should you want to check applications or SaaS applications like Dropbox or dare I say things like Netflix from a guest or patient perspective, those are also services that you can run the synthetic traffic against. So a very powerful tool sits in your environment and begins to give you real-time feedback on how users are experiencing your network. Again, this is step number one in a trauma and an emergency. We've got to make sure the air is open and that's delivering what it needs to. For you as an IT operator, the implications are very real. It's easy to understand. You can see here this a reflection of the dashboard. Green means good. If it's yellow, that means there's a degradation of performance or impact somehow. And if there's a red circle, obviously something is very wrong. Real story here. I had a customer of ours. They deployed this sensor in their environment, and they were also using our ClearPass security software to do the network access control. And they had a cluster of ClearPass servers that were performing the radius functions and other pieces within the NAC. And they had been chasing an issue, a DNS issue, with those servers for a long time. And they couldn't quite figure it out. It was haunting them, in fact. It wasn't, the performance wasn't down, the system wasn't down, but it wasn't performing optimally. They deployed the CAPE sensor, the user experience insight sensor, and ran synthetic traffic to check into, the radius authentications of ClearPass. And sure enough, they were able to uncover the DNS issues and the domain stuff that they were having a problem with, and they were able to rectify it and get the full power of their ClearPass cluster back online, providing value for the network. So that's the power of it. It was very clear. It was a yellow, smiley face, or not a smiley face perhaps, but a yellow symbol, and it said, hey, we're noticing some issues here. And then it's pointed to, you can hover over the different little links that it points to and says, hey, these are the issues that we're facing. This is what we're seeing. And so it makes it a very powerful tool, for one, how simple it is, and two, how simple it is to use for you as an IT operator. And so again, CAPE is a powerful tool for us to deploy across healthcare, because it's going to give us the real-time view of what our users are experiencing, and it's going to report back in a simplistic way so that we can understand the steps that we would need to take, and that we can do the right things to make sure that our IT network, our healthcare IT network, is going to remain stable and to continue to deliver on the type of experiences that we expect it to do. So with that, I wanted to say thank you, and I will pause here for questions. Looks like we've got some coming in from the audience, and appreciate everyone's time, and we'll look forward to chatting with you further.
Yeah, let's do some question and answer, Samuel. And there are a few that have come in already, and a quick reminder for those of you who haven't had a chance to ask a question yet, there is an Ask a Question tab underneath the slide window, and you can type your question in there. And as I said at the outset, if you're joining a little bit late and you missed it, if we don't have the answer for the question, we're not going to pretend that we do. We'll find a colleague at Aruba to get an answer for you, and then we'll reach out to you directly at the email address you provided. So first question is this the same as Air Monitor? And if not, how is it different?
Yeah, it's actually a really good question. Air Monitor, let me define that real quick. Air Monitor is a common wireless deployment where you'll put an extra access point into the environment that's dedicated to just listening to the radio atmosphere, to the radio signals that are in the air. So it's not connecting user traffic, it's just listening. And so this is a bit different. So whereas the Air Monitor is focused on, hey, what other radio signals are we hearing in our environment? It's a great way to diagnose and see if there's maybe an unauthorized broadcast signal, or if there's a honeypot or different things like that that are happening. Airwave, or an Air Monitor, does that really, really well. What this is going to do is this is looking at the actual user traffic that's going onto the network. So the user experience insight sensor is actually connecting to your wireless, because it's going to use the different authentication methods, whether you have a PSK or WPA3, you name it. It's going to join your wireless and also join your wired networks to behave like a user. So it's not necessarily listening to the air. It's more pretending to be a user and then sending traffic over the air to the existing wireless access points or wired network.
Okay, I'm going to mark that as answered. So the person who asked that question, if it's not exactly what you were looking for, just let me know by asking the question again. Here's one. Not sure if you covered it, but do you have any special offers around UXI?
Yeah, I believe we do have some offers around the UXI, user experience insight sensors, and I believe they're for healthcare customers, where Aruba has prioritized the support to the healthcare sector. And in North America, the United States and Canada, we are offering 5 free UXI sensors so that you can begin to put them in critical areas. Hey, perhaps it's actually a hot zone where you don't want to send IT staff in. You want to be able to monitor network performance and user performance there. So that we do have some offers around that. Feel free to either connect with us, and we'll pass you on to the appropriate folks within our sales organization that are responsible for you, because that's the route that it would follow.
Yeah, that's a good point, Samuel. So just go ahead and respond in the ask a question section, and let us know that you'd like to get connected, and we can connect you for sure. I'll go back and I'll kind of connect the email address, and we'll make sure somebody contacts you. So thanks a lot for that. This is a question we get, and I don't know how or if it applies here, Samuel, but we get it on pretty much every webinar. How does this solution compare to Cisco/Meraki? And I don't know if it does or not. That's why you're the one presenting and I'm not. But you want to take that?
Yeah, absolutely. Yeah. So this is actually very different than the Cisco Meraki solution. So Cisco Meraki is going to provide, and obviously they're an enterprise company that provides wireless connection and wired as well. We don't want to. They do offer that. This is very different than that. So I don't believe that Cisco Meraki has a methodology to send synthetic user traffic across a wired or a wireless network to be able to justify and report back on the user experience. While they have, now the thing is that this UXI sensor can be deployed in a Cisco or a Cisco Meraki network and run synthetic traffic against it to provide the same feedback to IT. So it's not dependent upon the network manufacturer to return benefit and value and information to healthcare IT. But no, this is very different. This is not actually connecting user sessions like a Cisco Meraki would. This is sending out traffic across an existing network to report back on the performance of expected outcomes.
Perfect. All right, thanks for that question. I will remind folks that the attachments and links currently, due to a mix-up on our side, are the attachments and links for the Thursday webinar that we're doing around education. So we apologize for that. I apologize for that, and we will be able to swap those out with the right ones for this webinar, the right attachments and links, and the on-demand, which will be available about an hour after we finish up here today. So just wanted to let you know, we've had a couple of questions about that and letting us know that some of you have found that there's a mismatch, so we appreciate it. And also a quick reminder that the poll question today was, in your experience, what most commonly prevents a good user experience? We had a good response, a good volume of responses, and overwhelmingly the network was the culprit there, with devices, users, and applications finishing in a dead heat, but a distant dead heat for second. So thanks for responding to that. I'm sorry, Samuel, go ahead.
I was going to say that these are actually really impressive poll results. One from the number of votes we've received. So if you've not had the chance to vote yet, though, we do want your voice. But two, I mean, how absolutely overwhelmingly the winner of this poll is the network. I mean, that's 60% of the responses are saying the network is the main culprit. That's impressive.
Yeah, for sure. And we have a couple more questions we want to get to, but at the end of this, and one or two of you have already given us some feedback on the webinar. We appreciate that. And Samuel, you're getting some props already. So
wow.
we'll share those with you afterward. But you know, in the feedback section, if there's a healthcare-related topic or you know, something that you think would make a good webinar for the healthcare industry, specifically healthcare IT, please let us know in your feedback. And again, that'll come up as you go to exit the webinar when we wrap up here in after the question and answer section, and I add a couple of items. But another question here is, and I'm not familiar with this company or solution, Samuel, so you'll have to let me know. Is this form of networking different from SolarWinds?
Okay. I think what they might be asking is network management or network monitoring different from SolarWinds. Yeah, in SolarWinds, obviously, they're an industry leader from kind of network monitoring and performance monitoring of the network, taking you know, packet captures and really making sure that they understand how the network is behaving. But yeah, no, this is a bit different than SolarWinds. And so the way to look at it is SolarWinds is going to provide you a view of the networks view of performance. So how is the network performing and behaving, and what's happening inside of the network? And that's very valuable information. Obviously, any troubleshooting or any type of looking into the network performance you need to do using tools like SolarWinds or Aruba's Airwave or other pieces that are going to come together for that. But what this is doing is taking a very different approach. And so it's like, here's the analogy I'll use. I don't golf very often, so when I do golf, I end up hitting the ball into the bushes regularly. And I remember one time I was golfing with some friends, and the marshal at the first tee said, "Hey, just a quick word of advice. If you're looking for a lost golf ball," he suggested to walk further into the weeds than you thought, and then walk backwards towards where the ball should have been in the fairway. He said that change of perspective is going to actually help you see where the ball is, because most people are looking from the fairway into the weeds. And he said, go into the weeds and then look from the weeds into the fairway. That different perspective is going to actually make a difference for you to be able to see more clearly. This is the same type of thing. We're looking at this from the user's perspective and not the network's perspective, which is a very valuable piece of information. One, when the network is behaving badly, you may not know it. A SolarWinds or a network monitoring platform may not catch it, but your users do catch it. They do understand. They may not be able to put words to it to say, this is the problem, but they're going to understand, hey, my applications are slow. And so what this is going to allow you to do from the user's perspective is to be able to take the proactive action when they're experiencing just inconvenient slowness or more latency or more jitter or any of those pieces that are in the network that the user can never explain to you properly. But you as an IT pro, you do understand what those things are, and now you're going to get a user's view that this is happening and be able to take the appropriate steps.
Perfect. Thanks, Samuel. Here's one. How does UXI, I think it was a typo, how does UXI compare to Juniper Mist? And I know we've talked about Cisco Meraki, and for those of you who have been on this webinar series, the questions around Cisco Meraki have come up, and we're hearing more about Juniper Mist now on some of these webinars as well. So can you describe the comparison, UXI against Juniper's Mist?
Yeah, again, it's a very similar answer to the Cisco Meraki answer in the sense that Juniper and Mist are providing wireless connectivity and wired connectivity. And Mist is making a lot of claim about their AI-powered, operations basically for wireless and wireless configuration and really, leveraging that power. That's their big claim to fame. And I'm not going to speak ill of Juniper Mist. That's not something that I think is appropriate. However, this is not something that Juniper or Mist does. They don't have a sensor that's sitting in your environment to be able to run synthetic traffic. And again, the UXI sensor would compare and would sit inside of a Mist network and a Juniper network and be able to run the type of traffic that's reporting on the deliverables that you expect, no matter and regardless of the manufacturer of the network.
Okay, thanks for that. Here's one. Can you describe some of the common deployment methods?
Yeah, absolutely. So one, I mentioned it in like that, really critical conference room. You could place this underneath the conference table in that conference room, and no one will see it. They'll just run traffic and make sure that it's giving a really great user experience for that one conference room. I've also heard of health systems actually that will place this on a workstation on wheels and allow it to roam around as that workstation on wheels goes around a different unit or department. Those devices are very mobile, and they typically have, you can typically secure the device to it, and it's a really great way to have a mobile view of the network. Another thing people will do is they'll, just kind of deploy them interspersed throughout their network itself. On a typical average, this is a highly generalized statement, so don't hold us to it necessarily. It obviously would be very dependent upon specific environments and configuration needs. But for every 6 access points you deploy, we typically see about 1 of the UXI sensors that gets deployed as well. And that just sits, secured to your wall, plugged in via a wire, and also operating on the wireless side as well. And it just begins to run the traffic against the network. That's a great way to give a very holistic view of reporting to to think of how we can better serve our clients on the end front there. So those are some pretty common ways that we're seeing these deployed. And obviously, the sky is the limit when it comes to some of these ideas. Hey, if now if people are working from home, perhaps it's a good idea to deploy one of these in the home of your executives, or maybe doctors working from home. It can be a part of that work from home kit to really ensure application performance and delivery. Some ideas there.
Right. No, thanks for that. I don't know if this question, and thanks everybody for sending your questions. I don't know if this question goes back to the poll or not, but this viewer is interested in your feeling about what the biggest challenge for healthcare IT will be coming out of the pandemic.
Yeah, I think there's going to be a real need to prioritize. And I mean, this kind of touches what we said earlier, but obviously healthcare is facing a significant financial hurdle. I think most states are now offering or have reopened for elective procedures. Rural healthcare has just been absolutely decimated in a lot of ways, and so we're going to need to see a lot of support and help brought to the healthcare industry. So I think that's going to be a huge challenge for healthcare IT. But what that does is it creates the climate where the projects and the initiatives that were on the table, maybe finishing 2019, going into a budget year 2020 or calendar year 2020, perhaps there was an initiative to do X, Y, or Z inside of the network, whether performance improvements, upgrades, changes, cleanups, you name it. Those are really going to be put on hold, and we'll really, I think, only go forward based off of the ability to tie the outcome of that project to a real business need. So we're going to see the biggest challenge in healthcare IT being, how do I tie the regular day-to-day operational best practices of running a network, how do I tie that to the real focused and prioritized business outcomes that our health system is needing to achieve? I mean, for years, healthcare IT has been told, hey, you just got to do a lot more with a lot less. But I think now there's going to be an extra layer of, wait, why do you want to spend that money again? And as long as we can tie it to patient experience, simplification and automation, security, those type of real critical priorities, I think are going to be what is necessary. And so I think those are going to be really big changes and challenges for healthcare IT.
Sure. Okay. And he said it here first. This will be available on demand, so we'll get to go back and see if you're right, Samuel. Sorry about that. It's a dig at Samuel. Yeah. He's a veteran of these webinars. So anyway, we do have one that I wanted to save to the end here, and it looks like this is will be our last question, unless, as Samuel is answering, you want to ask another one. Feel free to do so. But can you speak? I think this was someone who came late and maybe heard the tail end about the free sensors. Can you speak about the free sensors again? How many are available? Is everyone eligible? Basically, this is someone wanting to see if they could take advantage of the offer.
Absolutely, and we would absolutely love to make sure we get you the free sensors to support you. The way that I understand the program, and I'm going to beg forgiveness if I speak out of turn here, but the way that I don't manage this program, but the way I understand the program is that the program is for healthcare customers. It is for in North America, so United States and Canada, and it's 5 free CAPE sensor, UXI sensors for you guys to do. And it comes with the support contract. So it comes with all the things necessary for it to operate. Now, I know as a former Aruba salesperson, your sales team would be more than happy to get you a demo trial test unit of the user experience insight sensor to make sure that you guys can really validate the performance and what it's going to deliver for you. So again, reach out to Anthony or myself if you have a specific question on that. We will make sure you're connected with the appropriate people who will manage that process for you, because we absolutely want to get this into your environments, because again, I think this is going to give more data about the critical user experience, and it's very, very necessary for healthcare right now.
Yeah, no, I appreciate that answer. And again, if you would like to connect with someone who can help you get more information around that, just go into the Ask a Question tab underneath the slide window. You should see it on your BrightTalk interface there next to the attachments and links. Let me know, and I monitor that session as I've been doing, and we follow up directly with you afterwards. So I really want to say thank you, and I appreciate it, Samuel. And that's going to end our Q&A session. I have a few other things I want to do before we wrap up here, and one is correct myself. I think at the outset I said this was our 7th. This is our 8th. I forgot our Business Continuity Federal webinar that we did back on April 2nd. So this is the 8th in our Stay Connected webinar series on business continuity. Of course, we invite you to visit the arubanetworks.com. That's the URL, arubanetworks.com. There's a home page. If you scroll to the bottom and you click on the webinars link in the menu, at the bottom of the page, it'll take you to the landing page to watch the past webinars on demand or register for any future webinars that we do. And we do have one coming up in a couple of days on education, so you can take advantage of that. And of course, feedback. A couple of you have given feedback already. Thank you. We invite you to rate the webinar on a 1 to 5 star scale. Tell us what you did and or didn't like about the webinar. That's fine too, as it helps us make adjustments. We appreciate it. It helps us improve the overall webinar series, and each time out I think we're getting a little bit better. So Samuel, thanks a lot again, and we appreciate it. We look forward to the next time that you're on with us, and we want to thank you all for attending today. It looks like we had a pretty good turnout, and thanks for taking part in the poll. As I know, many companies are doing webinars now. It's an opportunity for companies to put in front of you some of the things that they're doing. We know you have a lot to choose from. I hate to sound like an airline or one of the airline departure messages. We know you have a lot of different webinars and companies you could do webinars from, but we appreciate you taking time to attend ours. That's going to conclude today's webinar, and thanks again, and until next time, we invite you to have a great day.